In the last 20 or 30 years, we've actually made significant progress in the fight against cancer, and that comes in on several fronts. We do a much better job of detecting cancers earlier, and when we detect them earlier, they're easier to treat. We've also made significant progress in the treatment of cancers so that lots and lots of people who are diagnosed with cancer respond very well to the treatments and survive for the long term. A cancer survivor is anyone who has ever been diagnosed with cancer, and so it starts at the time of diagnosis and continues on through the course of the patient's life, whether that's during treatment, after treatment ends, or for people who are living with cancer in the long term. We know that cancer survivors do have some ongoing long-term effects from their treatments, and so there's an increasing focus on recognizing those long-term effects and treating them. Many cancer programs in the United States are accredited by the American College of Surgeons Commission on Cancer, and in the last year or so they have given us some additional standards to meet to try to address the needs of cancer survivors and also to address the quality of life needs that we know many cancer patients and survivors have. Every program that is accredited by the American College of Surgeons Commission on Cancer is going to be expected to meet these new standards, and these standards address things like making sure that patients have access to genetic counseling and genetic testing if that's appropriate, making sure that people are screened for psychosocial distress so that if there are things going on in their lives that might get in the way of them getting appropriate treatment, we find out early on and address those issues. The Well Beyond program at St. Francis Health is something that we're real excited about. It's our response to meeting these new requirements for the cancer program certification, and we saw this as an opportunity to do more than the minimum, as an opportunity to really create a program that can pull together all of the quality of life needs that cancer patients and cancer survivors have and try to address each individual's needs in a single location with a single person as the point of contact. Survivorship Care Plan is a summary of the treatment that the patient has received, and also includes recommendations for ongoing cancer-related follow-up, recommendations for other screenings, and recommendations for changes that the patient can make in their lifestyle. It's a really important document for the patient to have so that the patient has a very good understanding of exactly what treatments he or she received. It also serves as a good summary for the cancer treatment team and is a really important way to communicate with the patient's primary care doctor and other doctors so that once it's all said and done, we're all on the same page about what happened and what should happen in the future. The Live Strong at the Y program is a very well-developed program that helps cancer survivors focus on wellness after their cancer treatment. It focuses on things like exercise, diet, increasing strength and flexibility, and we know that those things help in the long-term management of cancer-related pain and fatigue. Nurse practitioner who provides clinical care in the Well Beyond program works very closely with the nurse navigators who help navigate the cancer patients through their diagnosis and initial treatment. One thing that we like to talk about when we're talking about the Well Beyond program is that this doesn't replace the role of your oncologist or the other members of your cancer care team. This is something that helps add on to what you're already receiving. And so this is a program that helps coordinate the efforts of your physicians and all of the other members of your treatment team. And for the long term, may be a place where cancer survivors can get the majority of their cancer care when doctors are more needed to take care of patients who are newly diagnosed with cancer. Well Beyond is available to any cancer survivor in the community. You don't have to have received any of your treatment at St. Francis Health.